Cone Health awaits final word that the Federal Trade Commission will allow the merger with Alamance Regional Medical Center to move forward. We'll tell you about that. Plus, we'll take you to one unit that's been in the top 10% for 3 years in a row. All of that and more in the April edition of CodeVU. Alamance Regional Medical Center stands on the verge of becoming part of Cone Health. The merger was announced in December of 2011, and we are still awaiting final word from the government. Chief Executive Officer Tim Rice was here when Wesley Long Hospital, Annie Penn Hospital, and Behavioral Health Hospital joined Cone Health. He says when you look at all of the components, from HR to materials to cultures, there's a lot to do.
And obviously you don't do that in month 1 or 6 months or 1 year or 2 years. It takes you several years to really fully integrate the organizations. We're going to start with a visioning of what does this new organization ultimately look like, and then work backwards to how do we make the steps to get to that vision.
We are planning our next steps while awaiting final clearance. So while we don't know what the merger is going to look like, we can tell you a few things about Alamance Regional Medical Center. It opened in 1995 as the culmination of a merger between Alamance Memorial Hospital and Alamance County Hospital. Today, 2,100 employees work at the 238-bed facility. There are 340 physicians on the medical staff. Alamance Regional Medical Center offers a wide array of services including angioplasty and cardiac catheterizations, a Level 2 and 3 neonatal nursery, an accredited cancer center, a wound center, and a sleep center. Satellite facilities include the Mebane Medical Park, which features day surgery and urgent care, and even a continuing care retirement community called The Village at Brookwood. One of the key players in making the merger work will be Jeff Jones, the new Executive Vice President and Chief Financial Officer for Cone Health. Jones comes to Cone Health from the Cleveland Clinic, where he was Senior Vice President of Finance for the clinic's regional hospitals. Jones came to Cone Health for the challenge of improving how money is billed and collected for our services. He also likes the growth that he sees.
Being part of the growth with Cone Health, so the Alamance merger is a very exciting time to be growing as part of this next stage in Cone Health's life, if you will. A lot of history here locally, and Cone Health is growing, so it's nice to be part of that history.
Jones plays on not 1, but 2 adult ice hockey teams. Don't be surprised to see Jones walking through your work area. Don't be surprised to see any senior leaders walking around. This senior leader rounding is a great way for leaders to see firsthand what is going on across Cone Health.
You get an enormous amount of satisfaction out of having those interactions with the frontline staff. You know, they're exceptional people doing amazing work every day, and we get to see that firsthand when we're out and about.
Broderick says senior leader rounding is all about being approachable, so approach them. Take a few moments to look over patient gowns and sheets before tossing them into the laundry. More than 1,200 gowns had to be taken out of service because they made it through the laundry with electrodes stuck on them. Once that happens, you can't get that electrode adhesive off, and the dermatherapy gown is ruined.
This is not what we want to see coming back for our patients. It really diffuses the whole therapeutic properties of the linen. So, for example, the smooth surface has now been compromised.
Griffin asks that you make sure pillowcases don't get thrown in the garbage and that you use transfer kits to clothe patients being sent to other facilities so that the dermatherapy sheets and gowns stay here. What do Cone Health medical staff members do when they want to check a lab result for one of their patients? Why, there's an app for that. The Epic platform on which Cone Health Link is based has a number of apps for smartphones and tablets.
Physicians like being mobile. Physicians like having information at their fingertips and being able to respond. Physicians who are on call can easily look at pending results and make appropriate clinical decisions based on the results, all in a mobile world.
Physicians and physician extenders find the apps at iTunes or the Android Play Store. It takes about 24 hours before the app is turned on. Users will have to log in every time they open the app as a security feature. For the third year in a row, the rehabilitation program at the Moses H. Cone Memorial Hospital sits in the top 10% of rehabilitation centers in the United States. The ranking comes from Uniform Data System for Medical Rehabilitation. It's a not-for-profit organization that maintains the world's largest database for medical rehabilitation outcomes.
One of our secrets is really teamwork. We have a team that works well together. They all know what each other are doing with and for the patient, and so they can share that information and make sure that everybody's working on the same thing, really 24 hours a day, 7 days a week while the patient is here.
So teamwork and continuous improvement are keys. Thank you to the hundreds of volunteers across Cone Health. 200 gave nearly 45,000 hours of time last year to Women's Hospital alone. They staff desks, escort patients, and make items for newborns.
They are extra eyes, our ears. They add that soft touch. They give the personalized service to our patients, to our visitors. They know what's going on sometimes before we do.
Volunteers are involved in nearly every part of Cone Health, improving the experience of patients, visitors, and employees alike. And so the bottom line is that volunteers add about $3 million to the bottom line of Cone Health every year. That's it for this edition of CodeVU. I'm Doug Allred, and we will see you next time.